Welcome and good day to you. My name is Doreen Cooper-Rooney. I'm a licensed massage therapist, MA 44729. I'm from Wesley Chapel, Florida with over 400 patients. I am the daughter of seniors and I have raised 38 children. It seems like I have dealt with some type of medicine since I was 18 years old. This child fell off a skateboard, that child got in a fight, mom's blood sugar's high, dad needs his teeth pulled, the other child broke a leg skiing. With all that is currently going on in healthcare, I have great concern with what I am seeing. I would like to show you the problems and find the answers that would benefit us all. I would like to introduce you and show you the benefit of integrative medicine. I can hear you in the audience groaning. Yet another speech on medicine. I too am tired of hearing them. So let me show you how to fix the situation so we can move on. In medicine, we fight many factors to help the patient, with the leading fight being between conventional medicine and alternative medicine. The secondary battle is on a government level, and last, but in no way least, how this has let big money run medicine instead of practitioners being able to work freely. Using a plan of integrative medicine would eliminate all of those battles and give we, the patients, the ability to make educated choices, the practitioners the freedom of treatment, and make medicine affordable to all. Like a prize fight in Vegas, I can almost hear the announcer. On this side, wearing blue trunks, we have conventional medicine. Can you hear the audience cheering? Wearing purple trunks, alternative medicine. Whoa! A cheer goes up from the opposite side of the arena. This has been a long, drawn-out battle, and neither side appears to be winning, and the biggest loser of all is the patient. Conventional medicine is what you see nowadays in hospitals and everywhere else. It's regular, physical, scientific, based heavily upon surgery and pharmacology. Dr. Andrew Weil, a Harvard physician and a supporter of integrative medicine, is quoted as stating, one of the greatest tragedies of conventional medicine is the amount of time doctors spend with their patients has come down so drastically. In some countries, like Japan, this is even worse, where doctors now see 30 patients in an hour and are called 2-minute doctors. I guess with the tragedy, they're like 1-minute doctors now, huh? Alternative or natural medicine is based in the use of herbs and natural practices that have happened for thousands of years. Ayurveda, acupuncture, Chinese medicine, and chiropractic name a few modalities in the genre. When you go to the hospital with your bag of supplements that your natural physician has attended you with, the attending physician and doctor might look at you like you're crazy. Do not be shocked and do not be amazed. This is how deep this battle goes. Being a student with a Bachelor of Science in Alternative Medicine who is going to go pre-med, let me give you a tidbit of something I've observed. Did you know currently there is no mandate for a pre-med student to take herbology or botany? There is, however, one mandate for them to take pharmacology. So a doctor doesn't have to know what's in the pill, just which one to push. I can hear you in the back. I did say Bachelor of Science in Alternative Medicine and going to be a medical doctor. How? Why? What would make you take such a path? I can see the integration of medicine. It is what is coming, it is what is about to come in medicine, and I want to be part of that. Integrative medicine is taking the best from both worlds and providing it to the patient, giving we, the patients, the chance to make the best possible choices in our own health care. To quote Dr. Weil one more time, integrative medicine means a true marriage, a system that draws the best of both aspects, ideas, and practices of all systems of healing. Let us next go to our government on every level and how they are corrupting medicine. They accept money for expensive gifts for votes from the AMA, insurance, and pharmaceutical companies. These people are not overly concerned with the health of their patients, only how much those patients can put into their pockets. We are talking about a $2+ trillion a year industry. Funny thing is that most of the people making these decisions for us do not have any type of medical degree. A good example of this would be Governor Rick Scott of Florida, whom, according to the MQA license lookup on the Florida Department of Health website, has never held a medical license in that state, but in fact has run several healthcare facilities. Though he did as much business in the hospitals, he ran the level of health care down, as people were no longer able or had time to care for the patients they were charged with. I have heard this from several clients. When I asked an ER nurse about it, I was told about how much more paperwork and how many more patients she had to take care of. She asked to remain anonymous. My son is now 28. When I gave birth to him, my nurse, Julie, only had 3 other young mothers to look after. I felt like she was one of the family, and with her help, I got to find out what being a new mother was. And I was given 2 to 3 days in the hospital. My daughters are now 21. And when I gave birth to them, the nurse had 10 other girls to care for. That being said, I didn't see very much of her. I cannot even remember her name. From the point the babies popped out, they and I were on a countdown as to how many hours before the insurance would no longer pay. In the years since, the room got nicer, but the care got so limited, it is actually much worse of an experience today. And we wonder why so many young girls are going through postpartum depression. Really? Another place you see care slipping is the use of transportation to nursing homes for clients who do not show immediate recovery. According to the insurance, it is cheaper for them. That is because they do not concern themselves what is actually best for the patient, only their bottom line. Young people in nursing homes recover much more slowly due to depression from their surroundings. I know you would want to get put into a room with a couple of 90-year-olds, huh? Come on, isn't it what we live for? Look around the room. Can we count 2 people in this room that don't take at least 1 pill a day? Think about that. When I was growing up, only people who were sick took pills. Now it seems like we all do. Pharmaceutical companies have worked their way into making us a pill-centered society. Got a bump on your toe? Got a pill for it. Got a rash on your butt? Got a pill for it. Need to get it up? Got a pill for it. When do we stop counting on the pills? In the end, it will be up to us patients to stand up for the right to have the use of integrative medicine. I wish to appeal to each and every one of you to speak to your healthcare provider about their knowledge of integrative medicine. I ask those of you who have insurance to request your provider have integrative qualifications. Do not be afraid of your federal, state, and local officials. Stand up and talk to them, for in the end, they too will benefit from better health care. In conclusion, I find when integrative medicine is used, I see much healthier patients, lower health care costs, and the ability to provide better care to many. With the type of health care fight that would no longer exist, practitioners could focus on education, and wouldn't that be better for all of us?